Sioux City fire stations have a new member. It's Cooper. He's a golden doodle. He's there to help personnel relieve their stress and help them get through the day. Joel, I'm Greg Friese. I'm a paramedic, a runner, and an educator. Tell us who you are.
I'm Joel Neild. I'm a registered mental health counselor intern, a former firefighter, and a paramedic.
Joel, do you have any experience with therapy dogs like Cooper that bring comfort and stress relief to fire and EMS crews?
I don't have direct experience, but I do know someone who used to handle a therapy dog, and I've talked with them a lot about it. So I'm familiar with a lot of the processes.
What do you think about this as a way to help people relieve their stress and just make the fire station maybe a little bit happier and have a little bit more joy in it because there's a dog?
I think therapy dogs are probably one of the most underutilized tools we have in first responder mental health. Therapy dogs are great, and they can do several things for us. Just bring them to the station, just petting a dog, it releases endorphins. It actually reduces the amount of cortisol in your system. It is just a natural calming agent, just having the dog there. So that's fantastic. Also, trained therapy dogs will signal when they sense someone is incredibly stressed. So they can be an indicator to be like, oh, I can see Joel over here. While he looks okay, the dog is signaling that there's a lot of stress coming from him. And then your peer support team can follow up with Joel in private or the next day with a phone call. So I think the dogs can be used in multiple ways to help us.
Without getting too scientific, explain to us what cortisol is and the effect it has on our brains and our bodies.
Cortisol is one of the hormones that gets released when we're in fight or flight. And, if it's constantly in us, people with PTSD or complex trauma, it's constantly running through your system and it really wears down everything. So it causes excessive tiredness, muscle fatigue. So it really does a lot of damage to your system.
I have a sense that it can drag out like well beyond the call. Are you feeling the effects of cortisol hours later?
Yeah, normally you're feeling it for several hours later. It's not like the adrenaline, which comes and then goes fairly shortly. The cortisol lasts a lot longer than that.
And do you have any sense of how it is that this therapy dog helps reduce our cortisol levels? Like what's the physiology there? Do you know?
I'm not sure the exact physiology. I do know that the releasing of endorphins will kind of bring us back into the parasympathetic nervous system. And that's what really brings us down. It lowers our heart rate, lowers our respirations, lowers our blood pressure. So all those feel-good hormones is what really brings us back down.
If somebody's listening to this and thinking we should have a therapy dog visit our station, or it sounds like this dog, Cooper, actually lives at the station, what kind of things do you think they should be thinking about as they prepare?
If someone is listening to this and wants to get a therapy dog for station visits or to live at the station, find someone in your area and contact them who actually trains therapy dogs. Because it's very important to have a trained therapy dog, because not all dogs are suited to be a therapy dog, and that's fine. The IAFF has a list of therapy dog handlers. You can contact them if you have a union local there. There is also a great agency in Connecticut called Canine First Responders. They do a lot of training, and they have a nationwide list of therapy dog handlers and therapy dogs that they can send. They actually get FEMA EMACs to be deployed to disaster areas.
Yeah, it seems to me like it might make sense to trial a dog first, like with somebody that's already an experienced handler, maybe schedule some visits and see if that's something that's a good match for your department's culture and personnel before going to the step where you take a dog, adopt a dog or buy a dog and then train it up. I think that makes sense.
Yeah.
Joel, you're a dog owner. What kind of dog would you want visiting you on duty?
I love dogs, so I just want a dog that I can pet that's kind of calm and chill.
Okay.
That's what therapy dogs are. So it doesn't matter the type of dog. I love them.
All right. That's great to hear. I'm partial to labs, but I know they leave hair everywhere. So maybe we want a dog in the station that doesn't shed quite as much. If you've had a dog visit your station or you're handling a therapy dog or even have one living in your department, drop us a note in the comments and tell us more about it, how we can learn more about the program you're doing. Joel, if people want to follow up with you and learn more about wellness, first responder therapy, or even get connected to those references you mentioned on therapy dogs, where can people find you?
You can find me at my website. It's joelneild.com.